Hello everyone, my name is Dr. Florence Keli. I'm going to take you through the process of doing a fine needle aspirate of a thyroid nodule. I will talk briefly about the thyroid gland. This is work done for the University of South Wales in the UK. What is a thyroid gland? It is an endocrine gland which produces two hormones, the thyroid hormones. It produces these hormones upon stimulation by the pituitary gland, which sits at the base of the brain. It is also referred to as the master gland. What are thyroid hormones and what is their function? Thyroid hormones are referred to as T4 and T3. They are chemicals required to regulate metabolism, energy levels, the heartbeat, normal function of cells and tissues, the growth of a fetus and its brain, and other body functions. How does a thyroid gland look like? The thyroid gland is the largest gland in the body. It has two lobes connected by a narrow band of tissue. It sits in front of the windpipe and it looks like a butterfly. Here is a picture of the thyroid gland. On the left, looking like a butterfly, and on the right, sitting on the anterior aspect of the neck, just next to the windpipe. What is a thyroid nodule? It's an unusual growth of thyroid cells. It is found by either palpation, ultrasound, other forms of thyroid imaging. It could be collection of fluid, hyper or hypofunctional area of the gland, a solid mass of cells which can be non-cancerous or cancerous. Sometimes there is no known reason for the nodule. What are the symptoms of a thyroid nodule? A thyroid nodule can cause a visible swelling of the thyroid gland. It may compress the structures of the neck, causing breathing or swallowing problems, voice changes, neck pain, swallowing difficulties. It may occur as a single or numerous nodules. It may be felt or seen on the neck. Most thyroid nodules are benign. A small percentage may be cancerous and need evaluation. How is it diagnosed? A thyroid nodule may be felt by the patient or doctor. It may be found at imaging such as ultrasound or others. The doctor will order for the following tests if a thyroid nodule is found. Lab tests to establish the functional state of the thyroid nodule, imaging of the thyroid gland, and a fine needle aspiration of the thyroid nodule. What is a fine needle aspiration of a thyroid nodule? It is a process of removing cells from a thyroid nodule. It is simple, safe, does not require anesthesia as the pain is quite mild. It is done as an outpatient procedure. It takes about 5 seconds. Why do you need a fine needle aspiration? This is to find out the cause of the thyroid swelling and to establish if the nodule is cancerous or not. How do you prepare for the procedure? If you are taking blood thinners, you need to inform your doctor as this can cause some bleeding. No other special preparation is required. How is a thyroid fine needle aspiration done? The doctor will explain the procedure to you. A consent to do the procedure will be obtained. The procedure may be done while you are seated or lying down facing upwards. Your neck will be hyperextended so as to expose the thyroid gland and the area of aspiration. The area of aspiration will be cleaned with an alcohol swab. What will happen before the procedure? You will be asked about difficulty in swallowing or any other relevant question. You should not swallow or talk while the procedure is taking place. Here is a short dialogue between a patient and a doctor before the procedure is done. Difficulty swallowing?
Not really, but when we say it's the first spoon,
You feel
you feel like you're uncomfortable like something is pressing on it.
How is the nodule located? The nodule is located either by palpation by the doctor or the person doing the procedure. It can also be located by imaging such as thyroid ultrasound. How is the thyroid fine needle aspiration done? The doctor or designated person will prepare the needles, syringe, alcohol swab, and a container with a preservative. You'll be seated or lying down. The front aspect of your neck will be cleaned using an alcohol swab. How is the thyroid fine needle aspiration done? The needle will be inserted into the nodule. You will sense the pain of a slight prick. The needle will be moved back and forth a few times, collect enough material. The doctor will then pull the needle out. The sample collected will be spread on at least 4 slides, then sent for analysis. 1 is air dried, 3 will be put in a preservative for subsequent analysis. What will happen after the procedure? A gauze will be placed on the site that was pricked. You will be requested to apply pressure on it to prevent bleeding. You will be instructed as to when to release the pressure and discard the swab. You will then be allowed home to rest. The doctor will communicate when the results will be available. Sometimes the procedure may be repeated if the results are unsatisfactory. Once again, my name's Dr. Florence Keli. Thank you for watching the video clip.